Good evening and welcome to tonight's presentation. So my name is Syed. I'll be guiding you to through the next 45 minutes to an hour or so. And tonight's topic of discussion will be acing the medical school journey with AMBOSS. Using AMBOSS and using other resources as well to enhance your preparation for your exams, both in medical school and of course for the MCCQE exams. So I know most students in the room tonight are third or fourth year, many senior clerks in the room, so welcome. And also congratulations for getting so far into your medical school studies and so close to the finish line. I'm sure graduation is right on the tip of the tongue, but that also means that you do have some responsibilities and exams to take care of. So why I'm here tonight is to discuss some strategies that will help propel you to that next level and make sure that you are adequately prepared at a high level for your studies. Zach, I know you're here with us tonight, so would you mind saying a few words as well?
Hi, can you hear me? Sorry, I had the wrong link.
No worries at all. Welcome, and I'm glad that you're here.
Yeah, thanks. So, hey everyone, welcome to this AMBOSS webinar. I'm Zach, a second-year student at Western and your National Officer of Services. So I worked really closely with the previous CFMS board and the team at AMBOSS to make this amazing offer happen. We're super happy to provide 2 months of access to all CFMS members, but especially 6 months of access for you guys, probably most of you in the class of 2021. The CFMS and AMBOSS really hope that you found the platform useful, and we hope that you find the webinar helpful, specifically for determining how you can best use it to prepare for the MCCQE, as I know that's coming up. So I'll pass it back over to Saeed. I know you're in very capable hands.
Thanks so much, Zach, and thank you so much for introducing the partnership as well. And we are very, very thankful for it and for everyone here at home. What we'll do tonight, as I've alluded to so far, go through an introduction about the AMBOSS platform specifically, and I'll get into that in the next slide. We'll go through a MCQ style question, perhaps a question format that you're very familiar with, go through some study strategies, and then we'll get to the role of AMBOSS in your academic success, and we'll bring it back together. We'll do a little bit of an exercise towards the end of the presentation as well, and of course, conclusion, we'll bring it home. So AMBOSS is an online learning platform built by doctors for doctors. So everyone in the room here understood the struggles, including myself. I forgot to introduce myself. So once again, my name is Syed, graduated medical school, and I am a clinical research fellow at Yale University School of Medicine. I joined the AMBOSS team approximately 2 years ago. I've held multiple different roles, one of them being the content lead for the medical student advisors. So I've worked with hundreds, if not thousands, of medical students on helping them achieve their academic goals by providing the sound principles required for academic success, and of course, utilizing and leveraging the AMBOSS platform for their benefit. So AMBOSS is a medical education platform built by doctors for doctors, with the idea that we can share our experiences and learn from our experiences so that you can do it even better. So getting into it, AMBOSS, let me share this one video here. What is AMBOSS? So hopefully that video gets your adrenaline pumping as much as it does for me. In a nutshell, AMBOSS is a online learning platform consisting of a library, QBank analysis, bringing together the most important resources and tools that you need in order to succeed for your exam preparation, and of course for your medical school studies as well. And before we get even deeper into the AMBOSS platform, let's speak about the questions themselves, and let's approach a MCQ question, MCQ being multiple choice question. When you're approaching MCQs, the golden rule is typically that you need to be able to apply the information, which is more important than being able to memorize the information and being able to regurgitate factual information. So knowing the information, understanding at a deeper level, and this is something I could do an entire workshop on and how to approach them, but some basic pointers. So let's take a look at this specific snippet from an AMBOSS article. We're looking at the topic of metformin. And specifically the metformin-associated side effects. So one of the most common ones that could be seen is metformin-associated lactic acidosis. And then you see some information in how it can present in the clinical features, and then the high-risk groups, and then especially in patients with cardiac or renal insufficiency. So we want you to be able to not just know this information. It's not just us, but it's important for you to not just know this information, but it's important for you to be able to digest it, understand it, and then most importantly, to be able to apply it into MCQs. And of course, it's not just about MCQs, it's not just about an exam, it's about clinical practice as well. So what we've learned from here in this snippet is that metformin is associated with increase of life-threatening lactic acidosis, especially in patients with predisposing conditions that reduce lactic acid clearance, renal or hepatic insufficiency. That's some background information. Perhaps you've learned it earlier on in medical school. And that increased lactic acid production can lead to sepsis, or even a combination of both, where you can have a patient with heart failure or low cardiac output. Keep that information and keep that context in mind as we move into this MCQ here. So here we have an 81-year-old patient that's admitted to the hospital due to acute decompensated heart failure. He has type 2 diabetes, hypertension, coronary artery disease, and CHF being congestive heart failure. Current medications includes lisinopril, metformin, and low-dose aspirin. He has smoked 1 pack of cigarettes daily for 45 years. His temperature is 99.7, pulse is 105 and regular, and respirations are 21, blood pressure is 103 or 64. Lab studies show the following. Now, so far, I've already used a mouthful of words to go through the specific question stem, but now we're getting to the labs, and then we're getting to what the question really wants us, what the question is really asking us about. Which of the following changes in the medication regimen is most appropriate in this patient at this time? So you see that we have taken the information in the previous slide, the background context and knowledge regarding metformin, and then we're applying that knowledge into an MCQ style setting. So I'm sure many of you can already draw to the conclusion that we'll eventually get to the answer choice of discontinuing metformin therapy. But there's more that needs to be done and more that we need to be able to do with this question stem before we should go ahead and answer these choices. So you have an elderly patient that comes to you with acute decompensated heart failure. He is hypotensive at 103/64. You have his labs, urea nitrogen is abnormal and creatinine is abnormal. And in this patient, they're asking about changes to this patient's medication regimen, which is a management question. So given the information and the context we had provided in the previous slide, this is a patient whose laboratory findings indicate pre-renal acute kidney injury with a BUN to creatinine ratio greater than 20:1. And this could be secondary to decompensated heart failure, which is cardiorenal syndrome. So what I've done is given you more context into this specific question and giving you a way to guide your thought process and bring information together, because it's important to be able to make these connections. So as we have already alluded to, in this case, the next best step in management, or what you should do in this case with this patient, is discontinue that metformin therapy because it's associated with that increased risk of life-threatening lactic acidosis. So stop that medication. This patient's renal insufficiency and heart failure with decreased output are both contraindications to metformin therapy, which should be discontinued immediately. And in this case, if you were to take it one step further and be like, okay, what's the next step? insulin should be given for inpatient glycemic control. So what we're taking home from this specific slide here, or this example of an MCQ, is that items or test items should reflect real life tasks that you would be asked to do. This is taking your knowledge of medicine and taking your knowledge of basic principles from pharmacology, many other topics within the basic sciences, and of course your clinicals as well, and you're applying it into clinical context. So in the environment of an MCQ. And this also gives the test makers an opportunity to evaluate your understanding of the specific topic. And it wasn't just a matter of knowing that metformin causes lactic acidosis. It's about how and why. And I'm going to get into the how and why importance in a few minutes. So study strategies. This is some information that is relevant to you no matter where you are in your medical school journey, whether it's third year, fourth year, or even earlier on. These are just pearls that we've put together based on evidence and based on research, and of course our experiences as well, and how students typically succeed on exams. So what I ask for you to do is take this knowledge and take this information and really apply it into your own settings. And this is something that you should be doing throughout the entire academic prep year, and of course, leading up to your own exams. So it's about trusting the process. Many of us can get out there and start playing soccer, but we're not going to be necessarily the best soccer players out there until we start building up our fitness and skills. And that really comes from practice. So to get better, you will only get better by doing, putting in the work, and practicing will make you eventually a better player. In my case, not so much, but let's bring it back to the academic setting. So most important factor in preparation. So let's bring it into the context of preparing for the MCCQE exams and of course for medical school. What is required for these exams is the ability to solve case-based MCQs. So the best way to improve at solving case-based MCQs is by actually solving case-based MCQs and putting in that work and refining your skills, refining your approach, and of course, revisiting knowledge and content as you need to. So strategies for scoring well. The strongest correlate is that the more unique questions that you do, the higher the score, and that's what translates to. Why? Because beginning to recognize information, or it allows you to begin to recognize in ways in which content is tested on exams. A high quality question bank ensures your preparation in a targeted manner. And this means that we take a look at which topics are more important for your specific study objective and your intents and purposes of studying. And that means that more important topics are repeated more, which is what we call high yield. And they're also tested in different ways to ensure that you have a sound understanding of each one of these topics. And doing more questions also allows and reinforces the formation of new memory retrieval pathways. So you take information and you apply it into multiple different settings, which makes you more and more comfortable when you get to the actual exam setting. And of course, the clinical context as well. Other factors for success, well, we've gone to the whole training for medical school is by doing case-based MCQs. That's our guiding light in this space and in this space right now. But why should we do more questions, and why should we be preparing at a high level? It allows you to apply knowledge, expose your gaps and weaknesses, developing strategies for the actual exam, and being prepared for the real deal. I want to spend a little bit more time on the knowledge gaps and weaknesses, and I'm going to come into that point later on as well. When you're exposing your knowledge gaps and weaknesses by doing questions, you figure out areas of improvement, areas you should spend some time doing in refinement, and really strengthening up your understanding. And that's how you start to see your baseline really improve, is by actually focusing on your weaknesses. And you shouldn't be doing feel-good studying. Feel-good studying is that, hey, I'm good at behavioral science, I'm good at, say, immunology or immunizations, and I want to continue making myself feel good by focusing on the specific topics. No, you shouldn't be doing that, because you should be focusing on your weaknesses so that you have a better overall understanding and you can start to perform at a higher level, both in your question bank and of course for your exam. You're going to get a lot of questions wrong, but that's okay. It's not about where you start, it's about where you finish. When I was preparing and when I was in my dedicated period, I was only about 6 weeks away from my own exam, and I was not performing well. Even within AMBOSS, I was scoring about 40, 45%. But that consistent effort and learning from my mistakes and exposing that knowledge gap allowed me to really redefine how I see questions, especially using many of the features that I'll show you within the AMBOSS platform. It allows me to learn information and see information, apply information in a different way. So I spent about 6 weeks working through the AMBOSS platform, and my score on my actual exam jumped by 31 points. So once again, I'm here to show you how I did it with the hopes that you use it for a longer period so that you have even a greater return and greater yield when it comes to your performance on exams. It's important that you start preparing early, use high yield review resources. We've already talked about the high yield before, making sure that you use the most integrated resources so you're not wasting time switching between inefficiency and all of that. You want to minimize that. Of course, you want to aim high. That's already the whole shoot for the moons. Even if you miss, you'll land among the stars type of the saying. Now, which other study strategies should you keep in mind? This is one of my favorite slides throughout the entire presentation, and I'm going to spend some time here. The quality of your preparation is more important than the quantity of your preparation, because you need to be able to go into depth of your studying, focusing on the why and the how. And you've perhaps picked up on me mentioning that earlier in the session as well. And it's not just about the what, because the what is the factual information. It's not difficult to go out there and memorize factual information. It's more difficult to be able to understand it and then apply it. And that's what the exams will ask you to do. And make sure that you're going deeper in your preparation, because that allows you to make connections and that allows you to differentiate between answer choices. I know that's the next point, but I'll hit on it here. Allowing you to differentiate between answer choices, because when you have multiple answer choices, or you have options in MCQs, you need to be able to distinguish between them. And how do you distinguish between them? It's by picking out information from your understanding or your own knowledge base, and being able to decipher between. And that comes from going deeper in your preparation. If you memorize things at a superficial level, or if you only know things at a superficial level, you won't really be able to do that. And that's when you're going to start making silly mistakes when it comes to practice tests, Q banks, and of course the exam. Study your weaknesses. And I've already alluded to this, but I already explained this in the previous slide, is you want to learn from your mistakes, identify those knowledge gaps, and I'll show you how the AMBOSS platform really leverages you to do that. Next point is to keep a notebook and or flashcards and review that daily with spaced repetition. Spaced repetition is a medical education term, concept, or just it's an education concept, I should say, where it means that you see information over and over again, perhaps in different ways, that until you really become familiar with it and it becomes ingrained in your memory, because it's about that memory retrieval pathway. When I was preparing, what I would do is, as I'm doing MCQs and I say I struggled with it or I needed to revise it more, I would rephrase the MCQ into one line and say, hey, what is this question really asking? So if we went back to that example with metformin-associated lactic acidosis, I would rephrase what that question is asking about metformin-associated lactic acidosis in one line, and then I would put a few bullet points to be able to explain what the concepts and the take-home messages there, or the key takeaways there are. And then I would be able to bridge and start making connections into other parts of medicine, other subject areas, whatever I need to be able to tie information together. That's how I did it. But another way to do it is with Anki. Anki offers you that spaced repetition naturally, where you can download your own, you can either create your own Anki decks or download an Anki deck that has the information that you need in order to revise over and over again. And we also have the opportunity to use it with the AMBOSS platform. And I'll put a link into the chat later for the AMBOSS add-on for Anki. And then another message is to revise information as if it's the last time you'll see that topic, because you don't want to be wasting your efforts by seeing it once and then revising it another time later on. So here, let's talk about the study approach. And these are more so the general principles and the more essential components of any exam that you may face, of course, the MCCQE. Take this and really apply it to your own setting, where you have a knowledge building phase, you have the question and testing phase, and then you have your final review or fine tuning phase. So in your knowledge building, this really, in my opinion, starts from day one of medical school. But of course, wherever you are at now, you can apply it to your own setting, where you're revising information from a high yield perspective, high yield content, because you're revising to fill in knowledge gaps. Perhaps you can also be doing this along with your medical school studies, where you see the information and then look in to see, okay, within this information, where's a high yield and where do I need to be able to extract this content and apply it into MCQs. In your knowledge building phase, you're gaining an understanding. You're not just memorizing, you're really going deeper in your understanding, I should say. You could also be using Anki for spaced repetition, because Anki sometimes has 20,000, 30,000 flashcards, and that's not something you want to be holding on to until later on in your preparation. It's best covered earlier on, especially in your knowledge building phase. That brings me to the next one, being practice questions. This is something you do throughout. You should be in your knowledge building phase. This is when you can intermittently use question banks, where you can see information, really pair it together with your medical school studies, and start testing yourself earlier on and saying, do I know this or not? And it gives you another opportunity to learn. And of course, the closer you get to your exams, the more you can ramp up your QBank usage, focusing on more unique questions. Unique being that you don't do the same questions or question bank over and over again. However, this is where you do more unique questions that you see for the first time, because that'll give you more practice and more ability to apply your information and your knowledge. This also helps you recognize the way in which concepts will be tested for the exams and allows you to study in a more targeted manner. And of course, learn test taking skills and time management. And then that brings me to the final one, or the final review period. This is kind of speaks for itself, where you will revise your weaknesses, identify and reinforce lower performing areas, and this is where self assessments really become crucial to see where you're performing, and of course, identify any gaps that you may have. Moving forward, this is something that I think is very important to be able to bring it all together in terms of how you can balance your preparation and your approach to exams. And this is an approach that was shared with me when I was preparing. Was that one of my tutors said to me, hey, think of your approach to the exam in two parts. Think of it as that you need to know your factual knowledge, but you need to be able to apply that factual knowledge, because both of them go hand in hand. So you need to know the information and understand the information, but also you need to be able to apply the information. So start doing both earlier on to balance your preparation, and that's how you get efficiency, effectiveness, and integration. And some of the resources on the screen that you see, you may already be familiar with. Of course, we're here speaking about AMBOSS. AMBOSS is an online learning platform, bringing it all together with the library, the question bank, and analysis, three components of the AMBOSS triangle, and I'll get into those in the next few minutes. Anki being that app, flashcard app that offers you that spaced repetition. Perhaps you're familiar with the Toronto Notes, and Osmosis being a high yield video series that gives you an overview of many of the topics in medical school. And then that brings me to the other half, being question banks, where you're asked to apply your knowledge. AMBOSS has a question bank where you can go ahead and practice MCQs that'll allow you to apply the information, especially tying in well from the library and of course your own medical school curriculum. You have the opportunity to practice with Canada QBank, and perhaps some of you have heard about USMLE World as well. Point being is that knowledge is of no use until you start putting it into practice. So now this is when I'm going to transition over and show you a little bit more about the AMBOSS platform. And if you have any questions, feel free to drop them into the chat, and I'll do my best to answer questions towards the end of tonight's seminar. Okay, let me go into, I see a couple of them already there. I'll certainly answer those. Let's go to the dashboard. So when you log into the AMBOSS platform, on the left side of your screen, you'll see library, QBank, and analysis. So those are the three individual components of the AMBOSS platform, and let's begin with the library. And contained within, you see subfolders, basic sciences, clinical knowledge, and clinical skills, and a few others. And this is where you can start deciphering where you can find the information contained within. And I see one of the questions in the chat being about using the AMBOSS material, using the step 2 material for the MCCQE 1 exam. That would be my recommendation as well, because I've looked into, and not myself, but also My colleagues have also looked into which material would be most relevant, and given the objectives of the MCCQE exam, we feel confident that the Step 2 CK knowledge and content within the AMBOSS platform would be most useful, and then opportunity to practice those questions. And getting into the next question about how many AMBOSS questions to cover each day, great question, but that really depends on where you are in medical school, your time commitments, and how soon you plan on taking your next specific exam. So Catherine, are you speaking about the MCCQ exam or something else? Whenever you get a chance, please drop that into the chat box. So let's get into basic sciences or clinical knowledge. I'll stick with clinical knowledge for now. Very cool. So yeah, so if you have about, Catherine, you have about 1 month till the MCCQE exam. Depending on, once again, depending on how many hours per day you have in terms of studying, it's hard without a detailed knowledge of your exact situation. I would say at least, I would recommend balancing your what you're doing in your clerkships or whatever you're doing, or if you're in dedicated period, trying to figure out a balance, trying to do at least maybe 50 or 100 questions per day. It's not about covering the entire question bank or trying to rush through it, because 1 month is quite short of a time period. But making sure that you focus on the most high yield information, trying to get through not necessarily all of it, but getting a better understanding of as much of the high yield as you can. So let me jump into the clinical knowledge here. And here you'll see you have the subfolders of internal medicine, surgery, pediatrics, and all of that. So let's go with internal medicine. And then here you have all the different specialties within. Let's go to nephrology. And then you see some more subfolders to cover each topic. And then that brings me to the articles specifically. And what articles are meant to give you a comprehensive understanding of each one of these topics, enough for medical school, enough for your exams as well. And you can go ahead and click into whichever one you would like. Another way to do that is by going up to the search bar here. And in this case, you can type in whatever, or search in whatever topic you like. This is where we jokingly have been called Google for medicine. So in this case, let me type in the topic of Lyme disease. Last year, I was up in Canada with my family. Not last year, the year before, and we were going down the Thousand Island stretch, and we stopped at one of the parks there. And I remember seeing in the bathroom there was a sheet, an information sheet on Lyme disease specifically, because it was a more high risk area. And I'll show you how we bring that into light with epidemiology in a few seconds. So each AMBOSS article begins with an overview and abstract that we used to call an abstract. It gives you an understanding of the topic. However, we want you to go deeper. So that's what the rest of the article allows you to do. I'm going to turn these features off for now, and I'll get to them in a few minutes. So many of these articles have videos embedded within. Many of these videos are created in-house by our physician editors. But we also have the opportunity to bridge into other high yield resources that I mentioned, Osmosis. So in this case, a video from Osmosis is made available. We have a dedicated medical illustration team that creates content like this. So we give you a better understanding of biostatistics and epidemiology. If you ever wanted to write your own notes within these articles, feel free to do so. You can write your notes, whether you're doing questions or whatever it may be, and they'll be saved within the specific article. If you ever want to provide us any feedback, one of our physician editors will get back to you if you have any questions or whatever it may be. If you were curious to see where we got any specific bits of information, feel free to scroll over brackets, and you'll be able to find and look deeper if you like. Flowcharts. Flowcharts really help keep my thought process organized. So I see a patient with a presenting illness, and I'm able to work my way all the way down to a diagnosis and management. Speaking of management, let's go down to the section on treatments. That brings me to general therapy. In this case, we know that the first line therapy for Lyme disease is doxycycline, but say it's been a while since I've reviewed that or been in microbiology or microbiology or pharmacology, and I need to refresh my understanding. I can click into it here, and that brings me to that specific article on overview of antibiotic therapy, section on tetracyclines, and I can review as much as I need to here. But once I'm done, let's go back to the treatment section here. And now that, once again, we're back at this table. Now, when I was in medical school, there were many different ways I used tables, especially I would cover them up with my index cards or my hand or whatever it may be, because I was trying to test myself and see if I really know that information. That's why AMBOSS has the feature of the table quiz here. When you start the table quiz, you see all the information within the table disappearing, and you can start clicking through it one by one to really test your knowledge and see if you know it or not, and promoting that active learning. And then when you're done revising, well, I'll expand these sections here, I would say then you have the opportunity to go ahead and practice with questions here. And then you can see that we have questions associated with this that you can revise the content and then apply them into MCQ style settings. I wanted to speak about these features here. Of course, time is of the essence. I know, Catherine, you have the exam coming up in 1 month, and I mentioned focusing on the high yield information. So high yield, what that does is condenses information down from this specific article to keep the most relevant information specific to your study objective. So information here is information that you should absolutely know, similar to the highlight feature. When you turn on the highlight feature, it highlights information that's directly linked to a question from our question bank. So it's making sure that you know the most high yield important information. And then that brings me to the learning radar. And when I turn on the learning radar, you see some information is now underlined in red. That is information information from a question I've done previously or completed previously. However, I've gotten that information wrong. So it's saying, hey, you got this question wrong. Spend some more time revising that specific topic, and perhaps even give another shot at that question, or do more questions on that topic. Next component would be the Q bank here. Let me go to create a Q bank session. And in this, you can narrow it down by whichever exam you'd like. Perhaps some of you are on rotations right now, and you can use the AMBOSS platform to practice for your shelf exams or just getting a better understanding leading up to the MCCQE. So you can go ahead and select any of them here. So let me go to pediatrics and say you wanted to narrow it down to cardiovascular. In that case, with that specific topic, you have 13 questions to pick from. But you could also save questions into folders, and I've done that here. Let me show you that in 1 second. Undo this, undo this. Let me get rid of question status. You can save questions into folders and then start to practice questions how you would like. And this gives you an opportunity to keep your studying much more organized. So let's go to questions to review. And we'll start study mode here. And what study mode is an opportunity for you to learn the approach to high yield MCQs that allows you to revise the information, but also learn the approach to questions. Let's go ahead and do that here. Learning that approach allows you, by using study mode, allows you to narrow down your thought process by turning on the key info button here, underlying the most important information for this question, similar to how you had seen it earlier in the slide on the question on metformin. Then you have the attending tip here, allowing you that link between information and that ability to see that helpful hint to nudge you in the right direction without giving away that specific answer choice. And then you can see you have the opportunity to work through this question here. So whoever can answer this specific question first correctly, please go ahead and drop your answers into the chat. And you have the opportunity to win a prize. So whoever can get this this MCQ correct first, and we'll go through it. Whoever can get it correct first will have the opportunity to win 3 months of AMBOSS access. So let's go ahead and get your answers into the chats. Perfect. The first answer choice was from James, and he said A, increased cortisol. Unfortunately, it's not that, but this gives you the opportunity to start revising by doing this question. Next being E, increased adrenocorticotropic hormone. It is not E. Let's go with B. It is B. Sorry, James. I know, I see the sad face. Anthony, congrats. Or no, not Anthony. Sorry, Arshia. Very, very sorry, Arshia. You have won 3 months of AMBOSS Plus. Congratulations. The answer in this case is B, decreased corticotropin releasing hormone, or CRH. I'll get back to it once I write. Arshia, can you go ahead and drop your email into the chat, and we'll send you a code probably tomorrow, definitely within the week. So when you get this question right, when you find the answer, it allows you to go ahead and click into adrenal insufficiency. And this is the integration that I've been speaking about all throughout. So on your left side of your screen, you have a question from our question bank. And on the right side of your screen, you have an article from the AMBOSS library. So you practice and you learn at the same time. So the information that you see that's highlighted in green is the information that you would have needed to know to answer this specific question on CRH. So in this case, congratulations, Arsha, you're the first winner, but we're going to go ahead and do one more question with an opportunity for one more person to win. So let's get I'll turn the key info and attending on, and let's get you the opportunity to win 3 months plus. Okay, I'm back, and Suman is the first one with the answer of A. Many people with the answer of A. It is not A. Gorov says B. Okay, I hope you're able to revise the answer choices as we go along, but I'm sure many of you are trying to jump to the correct answer in this case. Catherine says E. Very good, Catherine. Congratulations. Catherine, can you also go ahead and drop your drop your email address into the chat box? And the answer in this case is polyclonal T cell activation. We got the question wrong. It's important for us to be able to revise this. So here we're looking at superantigens activating a large number of T cells, resulting in massive release of cytokines, and specifically toxic shock syndrome toxin 1, TSST1. Okay, congratulations, Catherine. Let me just grab your email address really quickly. Okay, now that brings me, let me go to the final component of the AMBOSS triangle. Let's go to the analysis. Let me go and show you one thing. When you're setting your own profile, it's important to be able to keep your study objective tailored to what your specific needs are. So in this case, if you're a second-year student, I would say maybe do it for general studies. If you're in family medicine, go with family medicine. But in this case, let's go back to learning recommendations. And you'll see that it remains fluid with your study objective. So my recommendations for general studies here are based on the fact that I just did a couple questions on adrenal insufficiency. So the more that you do on that specific topic under your study objective, the more tailored these recommendations become. So if I changed if I change it now to say family medicine, let's go to profile. Let's go to family medicine, or that's medicine. Let's go to family medicine. Let's go save. you can go and now go under analysis. Oh, something is wrong with my account right now. That's weird. Let me go to medicine. Apologies for this. Must be a glitch in the login that I have right now. However, I hope this does not happen to you. If it does, please write to us at hello@amboss.com. There we go. Now it's tabulating all of my performance and then it's calculating the specific recommendations. So in this case, it's saying that it's presenting an algorithm taking multiple things into consideration, two of which I'll highlight. One is how I'm performing in individual subtopics, like in this case of diabetes, but also how high yield and how relevant those topics are for my specific study objective. So in this case, for the topic of medicine, diabetes is quite important and I'm not performing well. So I would go to that specific article, and apologies for the background noise, there's clearly an ambulance going somewhere. I would expand these sections, revise the information, make sure I have a sound understanding, and perhaps practice some questions associated with it as well. So I hope that gives you a solid understanding. I mentioned the AMBOSS add-on for Anki. Let me drop that link into the chat at this point here. And I'll show you the website as well, the page for that. So when you add on the AMBOSS, or when you install the AMBOSS add-on for your Anki flashcard app, what you'll see is that certain information that becomes underlined in different colors. When you have it, when you scroll over it, you can go ahead and present some context of that specific topic or concept. And then if you wanted to know more, you can go ahead and click into it to get directly to the AMBOSS library. So it links you into the AMBOSS library if you so desire, or it can provide you the context. And then the link that I've gone ahead and dropped in, you can try it out for yourself. And it's part of the whole membership and the access given. There's a question saying, how do we activate the AMBOSS CFMS membership? To my understanding, a email was sent out on April 1st, so go ahead and please check your emails. And that should have given more information on how to access your membership. And if not, please go ahead and write to hello@amboss.com, and someone will definitely get back to you about how to activate that membership. Okay. And then another thing I wanted to share is right here. Speaking of membership, for the CFMS, we know that the senior clerks already have access, as Zach mentioned, for the next few months. But if you're not a senior clerk and say you're a third-year student, you have the opportunity to receive 1 month free. So I will drop this link in, not that link, sorry, this link that comes up right here. So you can access it for yourself. And then when you go to monthly, you'll see it's 100% off, save 100%, $0. So hopefully this gives you the opportunity to leverage the AMBOSS platform for your study needs within the next month and give you an opportunity to really explore all the features that are offered. Finally, let me go back to the slides just to bring home a couple more points. So points to remember from today. It's a process, it's a learning process. There's a question about how to gauge your own performance. The question was along the lines of, I know you were only scoring about 40 to 45%. Where should you be scoring before writing the actual exam? That's really hard to say, especially I can't give you a specific percentage because there's a lot that goes into it. So it's not necessarily about your QBank percentage. It's more important that you have the opportunity to do those self-assessments and practice tests to give you a deeper understanding or a more accurate understanding of exactly where you stand when it comes to readiness for your actual exams. But along with those self-assessments, set those goals, create a plan, and begin preparing early. Use high yield review, updated resources, making sure that you have the information that bridges to questions that you are able to learn and apply at the same time. And the key message is it's about the journey, once you plan and prepare at a high level, have faith in your efforts. The exam is more of the accumulation of the work that you've put in, and not just a measure of your specific abilities and future success. So with that, I thank you for joining tonight. I hope this was an opportunity for you to take a look into your own preparations and learn more about the AMBOSS platform and how you can really leverage it to success for your own studies and your upcoming exams. I wish you all the best of luck. I'll be around for a couple more minutes if there's any questions, but feel free to explore the AMBOSS platform. And I wish you all lots of luck and be safe out there. Thank you. There was a question about changing the units for the questions in the library. That's a great question. I actually haven't heard of that one before, but let me see if I can pass that along to one of my peers. That's a very interesting point. Okay. So getting back to that question, as of right now, I'm not aware. Oh, sorry, sorry, Jennifer. I just wasn't saying anything. I was thinking of how we can potentially get the units to match. And as of right now, I can't think of anything. However, I have made a note, dropped it into an email to pass along to my colleagues to see if they can do anything about that. Okay. Doesn't seem like there's any more questions at this point. But once again, everyone have a great night and best of luck moving forward. Take care.